Hello. Good afternoon, friends. Usually, when we discuss an HPV vaccine, we usually discuss only vaccine. But here, this will be a three-dimensional approach. First, we'll discuss HPV disease itself. Of course, second will be the vaccination. And third point that we'll be discussing how to propagate vaccine in using the positive impact of social media that we were discussing just now. So, for this discussion, I have a learned panelist with me, Dr. Chetan Shah, Dr. Jitendra Ghavhane, and Dr. Kanaksinh Surma. Friends, HPV consists of a family of a so small double-stranded DNA virus that infects the epithelium. More than 200 different varieties serotypes has been identified till date, and they are differentiated by their genomic sequence. It is most commonly transmitted sexually disease of reproductive organs. Most sexually active women and men are infected once at least in lifetime, and some may be infected repeatedly. More than 90% of the infected populations eventually clear the infection. But then why we are worried is about the rest of the 10% who eventually continue to get infected and they develop either precancerous, cancerous disease.
Hello.
There is a limited public awareness with regards to the cervical cancer, HPV and vaccination. There is a huge gap that exists in the public awareness. A survey was conducted about from a group of pregnant women. Only 36% knew about the HPV vaccination. Only 5.3%, that means less than 6%, knew about the disease and HPV as a cause of the disease. So there is a huge gap of knowledge between amongst the general population, and not only general population. Why general population? Even pediatrician. A list of pediatricians were taken from the IAP, and they were sent a few questionnaires. Not 100% going for the HPV vaccination. They are not convinced till today that HPV vaccination is required. So there is a huge gap of knowledge, and today we are here to improve that knowledge, to how we can spread that awareness, not only with regards to the HPV disease, but also with the vaccine, and how best we can avoid the cancerous conditions. My first question will be, Dr. Jitendra, you will take it?
Yes, sir.
Which are the serotypes which are considered as a high risk? Out of there are 200 plus serotypes. So which are the serotypes which are high risk?
So, sir, if we look at the serotypes, out of those 200 many serotypes, what we are more worried about is those who are either precancerous or giving rise to direct association with producing the cancers, and we divided them into low risk types, low risk serotypes, and high risk serotypes. So, if we are looking at high risk serotypes, there are 16, 18 strains are most what we say is associated with 70% of the cancers, and others like 31, 33, 45, 52, 58 also are high risk serotypes. Whereas if we look at the low risk serotypes, 6 and 11 is one which is associated with the most of the anogenital warts and precancerous lesions.
Yeah. So one should definitely cover vaccines with all those
These serotypes,
high risk
yes.
serotypes.
Yes, sir.
Sorry. Dr. Chetan Shah, sir. HPV causes cervical cancer. Sometimes it is known as the cervical cancer vaccine only. But is there any other diseases that can be caused by HPV?
Yeah, it's not only cervical cancer that is being caused by the HPV virus. There are other precancerous conditions like vulvar intraepithelial neoplasia, which is called as a VIN, then cervical intraepithelial neoplasia, similarly vaginal intraepithelial anal. So all these are precancerous condition, and again they are classified into severity wise grade 1, grade 2, grade 3. Grade 3 has the highest chance of getting into a cancer. Similarly, vaginal cancer, cervical cancer, anal cancer and vulvar cancer, these are the commonest cancers that are being caused by them, and genital wart as by caused by 6 and 11, which is as mentioned by Dr. Ghavhane. And in addition to this, there is a recurrent respiratory papillomatosis. That is again a little bit obstructive lung disease, which is caused by infections with this human papillomavirus. So these are
So-
few of the diseases that can be caused by that.
So HPV not only does in pre-cancerous conditions, but many other cancers too.
Even oropharyngeal
Yeah.
cancer also can be associated with the HPV.
Oropharyngeal can also be considered, definitely yes. Dr. Kanaksinh, what is the health burden as far as the HPV disease is concerned, both globally as well as in
Yeah.
India?
Globally, almost more than 6 lakhs per year is the incidence of the HPV, and out of that, the death due to this cancer is almost 3.5 lakhs. While in India, the more than 1.25 lakhs, like the prevalence of the HPV infection, and per year the death is 77,000 or more. So I am telling to my patient that every 5 minutes there should be one death due to this HPV infection and the cancer. So we can highlight in that way only that it is too important. To
So it is
protect
huge
this
burden.
disease. Yeah, huge burden.
And the more
And,
of the burden,
that burden also can be preventable and very easily preventable.
yes, definitely yes.
That is the main thing.
A burden, especially as India is concerned, is also huge.
Yeah.
Dr. Jitendra,
Yes, sir.
what are the current guidelines as far as the HPV vaccination is concerned in adolescent
Right,
practice?
sir.
What
So-
is the age
Yes,
from
sir.
which we start and
So-
what are the doses?
Sorry. So ACVIP has given clear-cut guidelines, and there is no confusion about this. And what ACVIP says is start this vaccination from 9 years onwards, and in 9 years to 14 years, 2 doses are required, and beyond 14 years, 3 doses are required, and immunocompromised of whatever age, 3 doses are required. So depending on what licensing agencies have given the vaccine to different brands, we are doing below 14 years 2 doses and above 14 years 3 doses.
Yeah. So is in the upper age limit?
So, sir, the licensing agency has given different this thing. The previous old quadrivalent vaccine is licensed in only females up to 45 years, or 9 to 45 years of age. The Indian version, the Servavac, is from 9 years to 25 years in both male and female. It is licensed, and the nonavalent vaccine. Newer nonavalent vaccine is in boys up to 14 years and in girls up to 25 years. It is.
Okay, fine. Dr. Chetan bhai, why such a young age? The sexual activity starts almost after 18 years, and why you want to vaccinate at 9 years? Why cannot we delay the vaccination?
There are many factors to it. First and foremost is the immune response to the vaccine is the best at this age. And whatever studies they have shown is that the immunogenicity as well as the protective titers and everything that they generate at this age are the highest, and they remain and persist for a very long period.
So there is good immunity.
Yeah. So, and second thing is it gives a protection, and the third thing is it protects the antibodies are generated before the virus enters the intracellular material, because once the virus enters the cells, there is no antibody that is going to act on the HPV virus, which is intracellular. So the protection that we offer at earliest will give rise to protect them against the intracellular entry of the virus, which is the main cause of the disease. So that is where it is most effective. And third is, of course, the logistics also. They come to us very frequently at this age. After maybe adolescent, it's very difficult to catch them, and the moment we catch them, I think is the best time to vaccinate them at this age. So there are many advantages of putting in. Of course, the economic advantage, because there you need only 2 doses, whereas after 15 you need 3 doses of a costly vaccine. And of course, last and not the least is the amount of vaccine that is there in the society. We have to use to the people who are getting best benefit out of the limited resources. So cost wise, logistic wise, everywhere, I think this is the best age to vaccinate.
And lighter side, once the adolescent goes beyond our age, it will be out of our reach. So they will be in the physician's domain rather than our domain. Dr. Kanaksinh,
Yeah.
Considering the availability of both broad coverage, that is nonavalent, and limited coverage, that is quadrivalent vaccine, what factors guide you which vaccine to be
Yeah.
used and
The
why?
First is the sex and age. If my patient is female and if it is above 26 years, then there is no case. Only one vaccine is available. That is quadrivalent.
So,
Gardasil. That is the one thing.
schedule.
Similarly, if male patient is there and if it is above 15, then only one quadrivalent vaccine is recommended for that and drug approved. Right. So this is the one thing. So from we are starting by 9 to 15, then for male or female, all vaccines are available, and so we have to depends upon the financial condition of the patients, because the another one, 9 nanovalent, is more costly, so that's we have to give the preference to the parents. And it is said that where I am practicing in Udna, then I am not thinking of that. But if Chetan Bhai is there, then it is uh, insult to the parents if he is asking that whether I am using the lower cost vaccine or the higher cost vaccines. So this is one thing. After 15 years to 26 years, for the male, we have
So
no
depending
vaccines.
upon age and schedule, okay, definitely yes.
No vaccine
Anything
at all.
else?
And after and for female, all the three vaccines are there. So I have to go for the age, for the sex, and the third is the cost. And
If all three
everything
factors
is
are
okay,
favorable,
everything okay, then of course I will go for the 9-valent vaccines, because if I have to choose for my daughter, then definitely I will go for that.
so if permission with regards to the schedule, age, and of course cost factor,
Yeah.
you will be using a
Huh,
nonavalent.
because see, the result, whether it is minimum or more, that is there with the 9-valent. Only we concerned with the side effect. Then side effect is little bit local is more, as due to the adjuvant is of more in quantity. Otherwise, there are no major side effects if we are considering 4-valent or the 9-valent. So about side effect also we have not to worry. Then definitely we have to go for the whatever the more
So
benefit
your
with
choice will
vaccine
be
is there.
9-valent.
Yeah.
Chetan bhai has
One more thing I like to add is the coverage additional coverage offered by the additional 5 strain is very important, because
so scientifically
nearly-
speaking, 9-valent is definitely better
because
than
almost
of course, if-
these 5 additional types, that is 31, 33, 45, 52 and 58. These in together total they give additional 90 to 20% protection against the related serotypes. So that is a very important thing. 20% is a huge amount.
Yeah.
I mean, if you compare with the
Definitely. Dr.
So I
Jitendra,
think
you want-
in today's era, we have to go by a cafeteria approach. We have to tell upfront the vaccine efficacy of each strain to the parents, and costing also, and let them decide, because this is one disease where if I'm giving them quadrivalent and it is protecting 85%, and something happens later with a different strain, then they will say, I would have spent that time. You have not given me any option that time. So
So
we
the
have
best-
to always upfront or give the option and tell the cost
And
and,
let
what
them
is the
decide.
vaccine efficacy of this versus this, and then only take a
So quadrivalent protects about
defined
80,
decision.
80
there are many,
85%.
see, there are many patients who tell us, we leave it to you to decide.
Yeah.
So there are many patients who will tell, okay, you decide for ourselves. And naturally we go.
So about quadrivalent protects about 85% against the cervical cancer, while nanovalent protects about 96, 97%. So we have a definite better protection, broader protection with the use of the nanovalent vaccine. There are many misconceptions. As with the any other vaccine, there are many misconceptions with regards to this vaccine also. Can you throw, Dr. Jitendra, can you throw a light on this?
So there is in India or across the world, there is an anti-vaxxer lobby which is working very hard, taking the advantage of social media and all. So those vaccine messages, anti-vaccine messages are spread like fire, and then suddenly there is a everyone will ask, you have given last week only, and this you have not told. So there are many myths associated with, it will reduce the pregnancy and it will reduce the sex drive, and my upbringing is not like that. Why should I give this to my child who is from a conservative family? So many this thing is there, and it is only female vaccine. So why you are offering to my son also? So those many misconceptions because of lack of awareness are there, and which we have to clear it.
So all these are, to
Even
your opinion?
sometimes they are fear of some side effects like Guillain-Barré syndrome and like that. So we have to clear that also. And sometimes when we are talking about it is transmitted by the sex, then they may think of that it is the only for the those candidate who are sexually deviated or like that. That also we have to clear out this misconception.
So these are the common misconceptions as far
This
as the
misconception is there more with physicians also, that it's like before sexual debut. So this word gives a taboo around this vaccine.
So we should definitely clear those misconceptions before advising a vaccination. Dr. Chetan bhai, what strategies can a pediatrician adopt to effectively involve both adolescent as well as parents in discussion about the HPV vaccination? When you are discussing a particular vaccine with your adolescent as well as their parents, what are the strategies? What you will advise? Because somebody said, Dr. Kanaksinh only said, you are the good promoter of the vaccine, especially the upper level vaccine. So what advice you will give?
First and foremost is we will like to know their previous knowledge, because many patients come to us with already prior knowledge. This vaccine is, we want to give this vaccine. So for them for us it becomes easy to tell them. It's only just the type that we have to decide. So naturally that is one group of patients. The another group is not knowing or having some misconceptions. Then we'll have to discuss with them and diffuse their doubts also, whatever is there. Tell them the science about the vaccine. Maybe if they are a little bit more literate, we can explain them the strength of the vaccine, probable side effects, and what is the best time to take, what is the effectiveness of the vaccine, what are the diseases that can be. All the scientific data can be provided to them, and then a informed decision should be left to them to decide about the vaccine. Of course, the cost also comes into the discussion, and we leave them and we tell them we compare all the vaccines. We do give them extra time because it's a new vaccine, and we have to explain to them. Of course, then there are awareness things are to be done. That is a different story. I think I am just addressing the question that you are telling only in the OPD consulting how I have to handle them. Otherwise, there are many other ways of interacting with them, like through a community or through NGOs.
That
or
will
through,
come again in next part.
So maybe this is what I will do with them.
I
So-
think, sir, strong recommendation by physician himself is a one driving factor for, as sir said, ki many patients leaves on you. They will say ki you decide, sir, what is best for my child. So strong recommendation without any doubt from the physician is the most deciding factor which converts the parents into vaccination.
So when we talk about any vaccination, first let us find out what the knowledge that particular parents have with regards to that vaccine, or importance of vaccine. Then whatever doubt or misconception there, one should clear it. After providing all scientific information, then provide information with regards to the financial aspect, and then let the parent decide. They take the time. Do not force them to take immediately on that particular session. Let them think over it. Let them have a sufficient time of discussion with adolescent child as well. And then in next visit, you can go for the vaccination. That could be the effective method. Dr. Kanaksinh, recently only last session was about the network, social media influence. How important do you think the social media is with regards to the increasing awareness about this vaccination?
Yeah, it's a really much more concern when we are promoting our that benefits of these vaccines, because just now only I have the experience. Okay, when our badminton player Jwala Gatta had donated the breast milk, no, then 3 or 4 mother they came to me, okay, how it is possible and how we can do. So this is the correct example for vaccine also. So many a times I am telling, whenever they are questioning, no, then teenager girls comes to me, then I am telling them that you just Google that and you will see about the HPV infection and see the problem of the HPV and see what is, because basically, no, in our this society, many times they are not aware about the cancer, cervical cancer only. Then what is about the prevention, and then the what measure we are taking? So first we have to give them the idea about the what is cervical cancer and other cancer also, which are now related with the HPV. So we can, by social media, by that internet, they can aware about this thing. That is the first thing. Second thing is that cancer is a one. My first sentence is that this is the only cancer which you can prevent it, especially directly. Indirectly there are so many things, but this is only so that we can promote by the our WhatsApp messages, otherwise on the internet use, that we can tell them that. About the side effect also we can promote that there is no major side effect, because many a times whenever, even regarding the this our corona vaccines, people were afraid of that. So that type of the misconcept also we can clear by the use of social media, even with the newspaper also, and by using the trends of the celebrities also we can promote like that way. And similarly about the protection rate, that also, because many a times what happened that if you had given the vaccine for HPV, but that patient may die due to some other cancer, then also they are relating the same thing with these also, so there is no benefit. So that also we can promote by that this cancer can be prevented and 100% prevented if you have vaccinated your child or yourself within the time limit.
Yeah, so social media definitely have a positive role on the increasing awareness with regards to any particular infection or vaccination. So we can definitely use here also to strengthen the HPV vaccination. Dr. Jitendra ji, why it is important to vaccinate boys? Initially, we were using it female only vaccine, and now we want to promote it as a gender neutral vaccine. Why?
Yes.
How it is beneficial? Whether it is
Right.
beneficial only to the male or any beneficial to female also?
Correct. So now, previously when it was launched, this vaccine was called as cervical cancer vaccine. That was the biggest mistake of calling it as a cervical cancer vaccine. And all these years we are clearing that doubt. We should call it as a HPV vaccine, because HPV preventable vaccine, because HPV causes, as sir said, not just cervical cancer, but there are 6 types of cancers can be prevented by that. And many of the cancers out of that, and precancerous lesions like genital warts, anogenital warts, penile cancers, oropharyngeal cancers can occur in boys as well. So boys are also boys are the one who will transmit it to the our daughters also. So it is not just for their own protection, but for spreading also. Boys needs to be. Unfortunately, there is no like a screening program. It is in place by for female, like every 4 years they should do pap smear. That kind of screening is not available for boys. So these most of the cancers goes unnoticed, and there is no way that we correlate these cancers with the HPV cancer. So I think it is very prudent that we should introduce this vaccine to boys as well, so that the entire population of boys and girls, and calling it as a unisex vaccine goes long way.
Yeah, so there are many reasons why boys should also be given this vaccine. The first and foremost, boys are definitely prone to genital warts. It is good in number, 14% global burden. HPV vaccine can even protect the against the anal cancers in boys. There is no routine screening, as already been told. And there is one more thing. Female to male transmission is higher than male to female transmission. So if female is infected, male is also going to be get infected. So for boys himself, the one should be given a vaccine. So, and another reasons for the female, why to prevent an HPV vaccine is not just a responsibility of a female. They should not carry those burden on themselves, because it is not, if we promote this as a female only vaccine, the burden only lies on females. So it is not only female vaccine. And that is why we require a gender neutral vaccine.
Yagnesh bhai, the another thing is that whatever the malignancies we attach with the male, no, they are difficult to treat, not that much easy with the carcinoma. And there are no many screening tests also available, so you can take early. So it is better to prevent them.
Definitely. That is why gender neutral vaccination. Dr. Chetan bhai, Is there any other country? This is the India is the only country, or is there any other country who uses this as a gender neutral country?
There are many countries, nearly more than 100 countries have already included this gender neutral vaccine in their programs, and many of them, including developed countries, some of the even developing countries also have included, like Thailand and other countries, they have also included. So there are many countries who have included in their national immunization programs also. And the WHO also recommend, of course, they don't recommend gender neutral, they have recommended HPV vaccination to all the countries to include their immunization programs. So it's highly recommended by almost all the countries.
So India is not only the first or the only country which recommends gender neutral vaccination. There are many countries, right from America to even developing countries in Asia, they are using these vaccines as a gender neutral. Dr. Kanaksinh.
Yeah.
We are in an era of empowering Yuva. How does that initiative seeks to enhance the HPV vaccine strategies? How this can be utilized for our purpose? And
Yeah.
what role a pediatrician can play?
Yeah, because this vaccine is not only for the childhood vaccine, that can be used from 9 to 15 and 15 to 45 years of age. So definitely when they have to take the decision, we may tell them that, and they have more exposed to media, so they may have the knowledge of also vaccine with them. That was not possible with other vaccines. So here we can guide them, we can ask them to take the decision, and even financially also, when we are talking about the empower of the Yuva, they are financially also very independent nowadays. And this vaccine is little bit costlier than in comparison to other vaccines. So at that time when the Yuva is financially independent, they can, we may use this freedom for the vaccination also. We can ask them to take the vaccine. We may ask them to spread this message also by their power, their contacts. And similarly, whenever opportunity arise, then they may, even for their spouse, they may
Take the decision of
advantage
their own.
this to take.
Yeah.
I think we saw in previous discussions also the power of youth and the peer influence
impact.
of the friends. So I think they are the very effective messengers to the community, because friends, ek friend leta. I have received many patients who have come just because their friends took it. They tell their parents that my friend took this, so I want to take this. So it's a very important thing, because they influence. This is a age where the peer influence is maximum, and there you get the best results if you pass on the message through the youngsters.
And many times, Yagnesh bhai, our vaccination program main hurdle is the cost or the financial problem. Because where I am practicing, always they are asking that, okay, what is the cost? And then I said, જવા દો ની આપણે સરકારી ચાલી જશે. So here when the Yuva is independent for the financial aspect, then definitely it will give the positive impact to these vaccinations.
So Yuva should be involved definitely, and this is the only, this is the probably the only vaccine where they can be directly informed and they can understand what is the disease and how best they can be protected. Dr. Jitendra ji, what advice you will give to the new pediatrician about effectively advocating the HPV vaccination in their practice? How
Yes.
best they can do it?
Yeah, so for this only IIP has undertaken a project Angel where entire India pediatrician in different zones, from 5 zones were trained for about knowledge about this vaccine. So getting empowered with the knowledge and then telling this to patients or the other IMA colleagues and all became very successful, these things. So creating awareness is the most important thing for themselves, and convincing themselves that yes, this vaccine is required and this is not any kind of optional vaccine or something like that. So that was the first thing, and creating awareness amongst the our patients also is very important. Then when awareness comes, then when you are strongly recommending that vaccine, using the words like I have given for my child or I have given for my granddaughter or son, then it makes a very positive impact on the patients, and then they become take the vaccine. Not keeping this vaccine as a separate, but whenever they are coming for routine checkup, introducing this about this vaccine and talking about this whenever this child is come for sickness and now he's eligible. So once he is better, we will give this vaccine kind of thing in a routine thing, rather than giving in a special status, is very important for them. And providing the leaflets and information brochures outside your waiting area, playing some video clips on the your waiting area TV also makes a good impact on patient. And of course your doctor patient relationship, how it is, the most of the vaccination depends on that also. As sir said, they will leave it to you to decide about their child's health.
See, another thing I would say is the uniformity from all the doctors is essential. Because many times it happens that some grey-haired doctors, they don't recommend, "Hamare time mein aisa nahi." See, I think it's very essential that all the pediatricians across the country speak the same language. Otherwise, that creates a city, in some city, because some people are sitting at the fence in decision making. If they see such doctors, then they say, "No, it's not required." So I think it's essential that all the doctors speak the same words about the vaccine, same recommendations, and same strong recommendation to take the vaccine. So it's very essential to pass on this message to everyone.
Yeah.
And what we have to tell to our pediatric colleague that whenever that parents comes to us for the child's vaccination, they have to ask to mother also whether she was vaccinated against this or not. And if not, then these are the advantages still there. So it is not the vaccine for the children's only. It can be taken up to 45 years. So that we have to emphasize to our pediatric colleague also, because many times I have seen that we are talking about immunism of the child, and for the child only we are talking about HPV vaccine also. Not we are even asking to the mother whether she had taken or not. So that also we have to take.
And similarly, asking a first question whether anybody in your family has suffered or is suffering from the cervical cancer or any other cancer may be a good idea to begin with. WHO is dreaming an HPV-free world. Whether it will be a reality, whether it can be a possibility, what everybody thinks, one by one, each of you. Yes,
Yes,
Dr. Jitendra.
Yes, sir. Definitely, it is not a impossible dream. And if we are achieving the 90% of the girls with full vaccination coverage below 15 years of age, then definitely we will reach that goal. 70% of the women should be screened for the neoplasia, and 90% of the women who are diagnosed should be treated. If these three criteria are fulfilled, then definitely one day will come where it will be called as elimination, where cases will be less than 10 per lakh population.
Dr. Chetan bhai.
Yeah, I'll agree with the same thing. And already some countries have achieved this. A large reduction in the number of cases of cervical cancer with a good immunization against this vaccine. Again, the most important thing is together, pap smear examination at routine intervals, along with the proper vaccination at a young age, is almost likely to cut down the incidence by 90% in future. So I think this is the best strategy, combined strategy, to do a proper cervical pap smear examination screening at the recommended intervals, and the proper vaccination at the earliest age. That is again an important factor, because see, most of the elderly, even if the best of the countries, the coverage of this vaccine is nearly 50%. So there are 50% females who are left behind. For them, pap smear examination is very essential. So these two together, I think the best strategy is to control the cervical cancers.
I think
One more important thing is also there, because there are the studies now available. Still, IAP and WHO is not recommending the single dose or a maximum 2 dose. So that will make the huge difference. Because instead of 3 doses, if you are protecting the male or female with the 1 or 2 doses, then definitely it will make the difference. And of course, with the screening is must. And as it is, the treatment is also easy. So screening, detection and treatment. So and the vaccination, if all four goes together, then that is not a distant dream. But of course, then also it will take the time, because he also, you have mentioned that even at 2021-20 also, you may reach up to 4 per 1 lakhs only. But
So
Yeah.
there is
it
a
is the reality.
Yeah, there is a confusion in patients that I have vaccinated, now there is no need of screening. That should be also removed from. Many of the gynecologists also thinks like that. Ki now pap smear is not required because she is taken nonavalent vaccine. So
It
I
is
think
not a replacement.
yes, it's not a replacement. So here, as our PSM says, is a primary prevention, secondary prevention, and tertiary prevention. All types of preventions are required here to eliminate this
So
disease.
we have to keep in our mind that vaccine is preventive, not therapeutical. So that we may have not to miss.
So we have to have a multi-pronged approach. First and foremost is our vision. We should definitely visualize HPV-free world. Maybe not in my age, your age, or maybe in next generation. But one should visualize, only then there will be a program. Then multi-pronged approach. Multi-pronged approach in the form of screening, good treatment of positive patients, and as far as possible, prevention of the disease with the use of vaccination. Sir, we have few more minutes left, so only single liner answer to all these questions. Fast. We start from anybody can take any time. So, number of doses. If first dose is given before just completion of 14 years, what will be my status? 2 dose or 3 dose?
So as for initiation is before 14 years, one more dose is enough. There is no need of giving 3 doses.
So when you start vaccination before 14 years, second dose only any time in later in the life. Interchangeability of brand, whether we should advocate?
No.
As far as possible, no.
No.
Boosters,
No booster required.
no boosters at present required. It is useful for an older sexually active woman, maybe
Yeah,
around
so
the
till 45
35,
years
40,
of age we can recommend. Yes.
35, 40.
Yes, so
You
45
should
years of
advocate.
age. Booster you are saying, sir?
Beyond 35, 40, you should advocate, and how best it can be protected.
So the vaccine efficacy goes down as age progresses, but then it is
So with
not
a
zero.
caveat,
So
we should
some
inform,
protection.
there will be some protection, but it will not be 100% protective. Any screening required for older woman?
No.
Already sexually active? No. For lactating mother, can give vaccine or
Yes,
not?
yes.
So even many of gynecologists are advocating immediately in postpartum. They are advising this vaccine immediately postpartum. That is the best time to advise. If regular screening is done, do we need a vaccine?
Yes.
Yes. If vaccination schedule is started with quadrivalent vaccine, but now can we change it to nonavalent for the remaining of the doses?
Yes.
Any advantage?
No, advance we cover, but see, if at all we want to do it properly, then we have to give all 3 doses in more than 15 years, because you are getting the additional protection for additional 5 serotypes. You have to go according to the fresh schedule only.
Yeah, so that is the point to be noted. We can definitely change, but we remember for the new 5 strains which are there in the nonavalent, it will be insufficient protection if you do not complete the whole schedule with it. And what advice, if one adolescent girl has already taken a quadrivalent vaccine, 3 completed schedule, now she has heard about the nonavalent vaccine.
You can give it again 3 full doses.
CIP has not advised, but if you give, then also there is a protection against that another
Additional 5 serotype.
and that is even 1,000 more than the baseline immunity is. So we can give,
So definitely we can go for that
but
vaccination.
it is not cost effective. That is the main thing.
If audience have any question, we have 1 more minute left. Otherwise, I will say thank you.